And this is actually pretty bad because this patient doesn't have a diagnosis yet. It could be hemothorax, an accumulation of blood within the pleural cavity, and is most commonly caused by a chest injury. And a whole lot of other things. Hey guys, welcome to Unmodded Gaming. I'm the Unmodded Gamer, and I'm back with Project Hospital. And I'm going back, or I'm going to upload 2 times a week again this week. So I'll be making a new video on Thursday and uploading that on Saturday to see how that goes, because I've noticed making videos on Friday and uploading them on Saturday isn't really something I want to do when it is weekend. But for now I'm going to look at Project Hospital, and I'm going to have a look at what we have to do here. As you can see, it is 6:15 in the evening. The day shift leaves in 2 hours, and we have a patient's dinner until 7 p.m. And the clinic opening hours have ended, which would normally mean that I would skip through the night and maybe show you guys some exciting or interesting things that happen during the night. But today I want to do it a little bit differently, because I remembered that when I played this game in my own free time without recording it, I would go into the work tab, management mode, and have a look at the patients that I have at my departments. So I have Frank Jones, who is at emergency, filling 3 time, and we don't have a cure for him yet. He's getting his MRI taken, waiting for a doctor or technologist for examination. Right, that is available now, and it is being done. Okay, so I'm curious to see if we can find what he is suffering from, so that we can take him and do something about it. But in the meantime, I'm going to have a look at the internal medicine department. Then we will close this tab for now, and we'll see who is in here. We have Sarah Lee with cystic fibrosis. It's an inherited disease that results in a serious damage to the lungs due to recurrent pneumonia. Cystic fibrosis also results in a decreased uptake of nutrients from the gastrointestinal tract. And she has got an IV antibiotics for that. Okay. So what I'm looking for here is basically if patients have a diagnosis and if they're being treated, and maybe if there are some people who I need to keep an eye on, like Carol Miller here, for example, because she has pneumothorax, which is a collapsed lung, and I believe we have already seen a patient with this. And she has already gotten her treatment, it looks like. Right here. Thoracentesis. Invasive procedure to remove fluid or air from the pleural space. And she is at the HDU. She has painkillers. She has artificial ventilation and antiarrhythmics. Drugs usually given intravenously or as pills to suppress abnormal rhythms of heart. So Yeah, I gotta keep an eye out for her because she might collapse at any time. And she is going straight to the intensive care when that happens. Then we have Brooke King with a relatively minor injury, a nasal polyp, and it is a non-cancerous growth in the nasal cavity. Okay. And she's got an MIAP, MEEP or something. Right, here it is. Minimally invasive endoscopic procedure is used to treat various... Holy crap, that's a difficult and long word. Treat various otorhinolaryngological diseases. Okay, so... diseases in your nose, I suppose. Then we have Sarah Lee again. We already saw her in the examination room. And then there is David Jackson, who has thromboptopenia, a condition with significantly lower levels of blood platelets that are responsible for stopping bleeding by clumping and forming clots. Okay. What's the treatment for that? Platelet transfusion. He is at the HDU. So he might be something that we need to watch out for. Then we have Kate Brown, last but not least, at the internal medicine department with otosclerosis. Otosclerosis refers to abnormal hardening of the bone tissue near the middle ear, causing inability to transfer sound from the middle ear to the inner ear, resulting in loss of hearing. Okay. So I'll just go up by one story and I'm going to have a quick look at the orthopedic department. We have someone with knee bursitis. A bursae is a small fluid filled with filled sac which acts as a cushion between bone and areas prone to friction. Bursitis refers to swelling of said sac caused by inflammation. Okay, so these are all pretty minor things compared to the rest of the illnesses people have in this hospital. Simple fracture of clavicle without damage to surrounding tissue or breaking the skin. Okay, and an open fracture of the humerus. Right, so this is actually the patient I got from the ambulance this morning. And it looks like they have put her in the HDU. And they have already performed a surgery on her arm. So this is all being taken care of. Right. So let's move on to the general surgery department, which is pretty full. We have someone with cholangitis, an infection of the bile duct. Okay. Now this is interesting. Fistula of the intestine. I don't know what fistula is, but it says here it's an abnormal anatomical connection between two hollow spaces. Okay. Then we have someone with cirrhosis. And it describes a condition where the liver is malfunctioning due to long-term damage. Normal liver tissue is replaced with scar tissue. Then we have someone here with appendicitis. And he didn't get his surgery yet, so I'm going to say this is my favorite patient, and it remembers it here, so that if he does collapse or anything, I'm right on top of it. That is Mark Hernandez, waiting for surgical team. Well, I hope they get done with that before the end of the day shift, because as you can see, the day shift is coming, or the night shift is coming in just over an hour. I believe we already had this patient with cirrhosis, or we had a look at it, I should say. Then we have calculus of ureter and another case of calculus of ureter, which is just kidney stones. And then we have an infection of some sorts. I believe we had seen that before too. Right. So last but not least, let's go up one more floor. And we can see that there's only one patient at the cardiology department. Elizabeth Jackson, who we saw come in the last episode with IHD, with heart failure. And with that being said, I'm going to skip the night. And we got patients from the ambulance. And this is actually pretty bad, because this patient doesn't have a diagnosis yet. It could be hemothorax, an accumulation of blood within the pleural cavity, and is most commonly caused by a chest injury. And a whole lot of other things. So I have to find out what it could be ASAP. So I'll just do a chest osculation, listening with a stethoscope of the heart and lungs, abdominal palpation, and a physical examination to try and find out what she is suffering from, because as you can see right here, she has 3 hidden symptoms, and of which at least one of which she can pass away from at any moment. So we need to find out what it is as fast as we can. So I think I'll also do some neurological testing, a blood pressure measurement, and a thorax percussion. Let me see what that is, by the way. Examination based on systematically tapping on the thorax to identify areas with less air within the thorax. Okay. So she has a headache and she is dizzy. That doesn't rule out much, but maybe the blood pressure measurement will give us some more information. I always like to do this myself, because I always want to do the most critical things first, like heart monitoring, an urgent echo, and all that sort of things. And if there's anything else that I need to check for, that maybe giving us a sign as to what it could be that is life-threatening to her, I can, rule that out doing that. And I start with the most critical things first. We still don't know it. What else can we do here? We can do a differential diagnosis, stool collecting, blood draw, urine analysis, sampling, evaluation. This is getting to the point where I have to do things that take a lot of time, and that is not something I have right now, because I have to find out what it is that she is suffering from very soon, so I'm going to let the game run through the next few examinations so that I can maybe see what is going on with her. So they're now looking at the echo, it looks like. And they didn't find anything, okay. I had expected that maybe with the temperature or the blood pressure measurements they'd find something, because dizziness and a headache is usually something that would suggest the patient has a high blood pressure. But apparently they don't find anything that way. And the list of possible diagnoses is pretty long still. What is this actually? Sends an untreated patient to another hospital, right. And select a department. Okay. We are running out of options here. So I'll just throw in 2 more things myself. And when it is like this, I would also almost say that it is this, whatever it is. I can't pronounce it, but it's a disease where the plaques are built up inside the carotid arteries of the body, the large arteries running from the aorta to the head, the hardening and narrowing them, thereby reducing the flow of blood. It could be asymptomatic for decades. Symptoms often appear when arteries become more than 50% blocked. And the only way to find out if she has that is by doing an angiography, which is a method of visualizing the blood vessels and arteries in your body. And that would also show them if something was blocked. But now that I've done the differential diagnosis and the evaluation, it doesn't look like it. So it could be a migraine or a concussion. A diffuse axonal injury, I don't know what it is. But there's about a 50% chance she'll end up at neurology, which is the department I haven't opened yet. And things here take a pretty long time before we find anything. Hang on, let me just run all the testing and then I'll let them do a CT scan, because if it is something with her head, we are most likely to find it that way. Because so far we only have a headache and dizziness. Hang on, let me see if we can even do that. Let's go to radiology, and as I suspected, we don't have anybody at the night shift for the CT. So let me just quickly hire someone. Doesn't need to be someone who's particularly good or something, just quickly someone so that we can send the patient to the CT scanner. And with that being said, I'm going to finish this episode. This was the Unmodded Gamer. Thanks for watching and stay unmodded.